So here's a question about, could you talk more about autoimmune diseases? For example, rheumatoid arthritis. You mentioned Hillman said there is no such thing as an autoimmune disease. So this is a pretty complex, quote, argument, which I'm not sure I can reconstruct his argument off the top of my head. So I'll give a very thumbnail, simplistic version of it. So again, the first thing is always to say, what does normal medicine, what do they mean by an autoimmune disease? So they basically say, I don't know what happened, something happened, and you started making antibodies to one of your own tissues. So in the case of rheumatoid arthritis, to your own cartilage. And they basically would say there's no reason why this happened. It's just for some reason your body decided to make antibodies against your own tissue, which is different than what we're supposed to do, which is because we have the same, quote, genetic material in every cell of our body. They say you shouldn't, and they say this is against sort of the proteins or the genetic material of a cell. There's no reason why in conventional theory you should make antibodies specific to any tissue type because we're all the same tissue. But never mind, it does, and you can diagnose rheumatoid arthritis by finding this antibody called rheumatoid factor in the blood. Now, we know that all antibodies are not specific, so you have people with all the symptoms of rheumatoid arthritis who don't have antibodies, and then you have lots of people who have antibodies who have no symptoms. So there's no case to be made that antibodies are specific, rheumatoid factor antibodies are actually specific to rheumatoid arthritis. One of the things that Hillman points out is that if you look at the prototype for an immune system, which he doesn't really believe in an immune system, nor do I, but let's just say what we call an immune reaction to an organ. And the prototype for that would be if you transplant an organ into another person and it's not an exact match, which besides identical twins, it can't be, you have to stop the immune system from reacting and rejecting that organ. And typically, it will reject and react against that organ until the organ is completely destroyed, and you could even kill the person. Because if you transplant a heart or a kidney without drugs to suppress the so-called immune reaction, it will inevitably go to a complete rejection of the kidney or the heart. So he questioned, why doesn't that happen with autoimmune disease? If you have the same process, why does it just create variable symptoms in variable people? And as far as I know, there's no answer to that. And there's a lot of other reasons which he listed that made him think that this was a concocted, made up kind of diagnosis. From my point of view, again, as I've said over and over, we should always look at either injuries, you fell off a horse, you're starving of either food or nutrients or love or emotional support or something, or you're being poisoned. And so if you have a situation of rheumatoid arthritis, so you say, what does a healthy cartilage need? So it needs to have certain proteins. You need to be able to supply your body with certain proteins that come actually from the cartilage of an animal, and that is otherwise called bone broth. You also need to have adequate amount of vitamin C, and then those factors plus trace minerals, magnesium, molybdenum, zinc probably, and boron, all these come together to produce the particular gelatinous structure called a bursa or cartilage tissue. So this is an example of specific proteins using specific nutrients, minerals, organizing the water in a certain way to create function. So that's the system that we're talking about. Now, if you can imagine that somebody puts in some chemical that interferes with the structuring of that tissue, or you don't have any bone broth, so you never eat the kind of proteins that would supply your body with the amino acids and the proteins that you use to make this cartilage. So then you obviously end up with a distorted cartilage, which the cartilage then and the fluid that surrounds it acts like two negatively charged magnets that would come together, and because they repel each other, because they both have this negative charge, they create distance. So you have two cushioning effects. One is the gel, and the second is the magnetic repulsion, because all the gels are negatively charged. So then you have smooth movement of the joint. Now, if you don't have that, because there's something that interfered again, so you didn't have the proteins, you didn't have boron, you didn't have the right minerals, you didn't have the right pure water, you have chemicals that interfere with that process happening, you don't have any vitamin C or the right kind of nutrients in your diet, and you make gels that are not formed properly and they don't have the right charge. So you have your joint starts sticking together, and that creates a friction effect, which then rubs off the joint, and then you end up with pain and dysfunction of the joint. Now, your body then tries to deal with that by using its main rearrangement tool, which is inflammation. In other words, you've got this wonky gel, and the body brings heat and enzymes and probably white blood cells to the area, and it creates antibodies to bind with the toxins that either are affecting the joint or are being created by the inflammatory response. So again, the inflammatory response, albeit it hurts, it's also trying to restructure the joint so that you can recreate a more perfect joint. So that's exactly what you see, which is an inflamed joint and antibodies, which are there to neutralize these poisons. And the combination of an inflamed joint and antibodies against some of the proteins in the joint, otherwise known as rheumatoid factor, that is the diagnosis of rheumatoid arthritis. Now, if you could say, well, why do I think this is true? And again, as I've said, one of the ways of knowing the etiology, the cause of a disease, is to find out what works in treating it. And many, many years ago, I ran into a therapy for rheumatoid arthritis called bee venom therapy, which is a fancy name for stinging people with bees. Now, let's look at conventional medicine therapy for rheumatoid arthritis. So again, the problem, the cause is nutritional deficiency, so you have a poorly formed joint, or some poisonous toxic effect on the joint, ending up so that the joint fluid, the joint gel tissues are not formed properly. And that causes pain and dysfunction. And so that's the disease. the therapy is to bring an inflammatory response to try to restructure it so that you can recreate a more perfect joint. Now, conventional medicine says the inflammation is the disease, and so they give you things to stop the inflammation. First, non-steroidals like Advil and Motrin and Aleve and that stuff. And if that doesn't work, they use stronger ones like cortisone, prednisone, etc. And if that doesn't work, they block your ability to bind with the poisons, which is, or to stop the inflammatory process before it even starts. Now, if that actually was dealing with the cause, you would expect people to be cured by those therapies. And I can guarantee you, if you go to any rheumatologist and say, how many people have you cured of rheumatoid arthritis with either a combination or singly with non-steroidals or cortisone or prednisone or Enbrel or Remicade? The answer is none. In fact, we have very good evidence that the longer people take those drugs, the worse their health becomes, and in particular, the more deterioration of their joints. Now, they don't get the deterioration from acute inflammation. They just get a chronic degeneration of the joints, obviously, because the reason why the joint was not formed properly in the first place has never been addressed. And the ability of the body to remodel it with an inflammatory healing response has been suppressed. So that's exactly what all the research shows, which as time goes on, you get worse and worse and worse. And if you ever stop the Remicade and the Enbrel and the cortisone and the prednisone and the Aleve and the Advil, you will be guaranteed worse than you ever were before. And you see that not just over and over again, you see that simply with every single person who goes down that road. You will, if you ever stop, you will be worse than you were when you started. If you compare that with stinging person with a bee, what does that do? Well, it obviously increases the inflammatory response. It actually increases the enzymes and probably the white blood cells, and essentially it increases your garbage collection and remodeling system, so that when that provoked inflammation is gone, you are actually better than when you started. So it actually is a therapy that can heal the joint, heal you, not even just your joint, because the problem is you had a buildup of debris and your body was trying to use inflammation and you helped it along. And so then it's the whole situation gets better. When you combine that with giving people the nutrients and the sunlight and the energies and the minerals that they need, you can actually cure people of rheumatoid arthritis, because you're actually dealing as to what the problem is.